Hi again. This short section will take a look at some basic anatomy reference slides. It's intended to be reference, not for you to try to memorize everything in the slides, of course. So let's go ahead and take a look at the first slide. And it just shows the trachea and a couple of things to note. It's the bronchial tree, and the left side has two lobes, and so that says, if you can't read it, to superior lobe and to the inferior lobe. So this branch of the bronchial tree is going to the superior lobe, this branch going to the inferior lobe, etc. So these are major branches off of the tree. Again, on the left side, superior lobe, middle lobe, and inferior lobes. So superior and inferior, and then the middle. And on the left side, we just have the superior and the inferior. So the main idea is just to note that the bronchial tree divides, and these branches supply air and ventilate those regions of the lung. The other thing on the slide they put in here is the trachealis muscle. And the trachealis muscle is, these are the C-shaped cartilage rings of the trachea. They're open in the back. So the cartilage ends on the side posteriorly, and then across the back is the trachealis muscle, which runs vertically up and down the length of the trachea. And the function of that muscle is, when it contracts, it pulls the ends of the cartilage toward the center, and that essentially narrows the diameter of the trachea. It constricts the diameter, and that will narrow the diameter. And when you do that, air has to speed up as it flows through there. So this will increase the velocity of the air when you sneeze, the speed of the air. Air exhaled during a sneeze or a cough. So that's how you forcefully exhale the air. The same volume going out in a narrower diameter has to speed up. So not a lot of emphasis on this slide. Again, these are intended to be primarily reference pictures. If you like anatomy, you can learn quite a bit from them. So, there's a couple of things that you might notice on this picture. The phrenic nerves, right and left. You can trace them. They come back out. They come down through the carotid canal with the common carotid artery and the internal jugular. Some other things you can come back to when we get to it. You can see the pleural membranes around the lungs. And you can start to identify a few blood vessels that I'll put a yellow dot on. These should be pretty straightforward by now. Just for practice, just things to look at. You should be able to identify those. So, next slide shows the more of same. More superficial. Again, there are some blood vessels that you can identify that are on your list of vessels to know. These are pretty easy to spot in this diagram. Again, pleural membranes, sternocleidomastoid. And this slide is showing the medial view of the right and left lung. So here we are with the right lung again, and we have 3 lobes. We have the superior lobe, we have a middle lobe, and an inferior lobe. And then we have the hilum, which is this region of the lung. Hilum is a general structure, but that includes the passageway for the bronchi and the pulmonary veins and the pulmonary arteries. You can identify, go with color for deoxygenated, oxygenated. And the left lung, again, 2 lobes on the left, superior lobe and the inferior lobe. Next slide, pretty much the same idea. I think I just split those out. This one's a little fuzzier. And this picture is one to appreciate the, what I want to show are the different colors of the bronchial airways. So again, the right and left primary bronchus, and then we have branches to the different lobes. So the left lobe, the left lung rather, has 2 lobes that are basically supplied by those branches. So there is the superior and the inferior. On the left side, on the right side, basic idea again is superior and the middle and the inferior. So note the color change. So they're on both lungs, right and left, there are red airways, and then there are blue airways, etc. So on the next slide, what it shows are these areas of the lung that are ventilated by those branches of the bronchial tree. So you have an anterior view at the top and a posterior view below. But again, the red portion, the apex of the lung, was ventilated by those branches of the bronchial tree that we were just looking at. And then you have the green and the blue, etc. So to flip back to the previous slide, there are the red, the green, and the blue for the superior lobes. So this is why when you're listening for lung sounds with a stethoscope, you need to move the stethoscope around to different regions on the chest and the back to listen for these areas of the lung that are being ventilated. And that was it for that short section of slides. You can probably breeze through these. There's not going to be a lot on the exam, but it's there for your reference if you find it useful.